Coming up on American Medicine Today, the left's extreme push of radical policies may very well lead us into a civil war they've been aiming for. Robert Spencer joins us to highlight some of the left's strategies in his new book, The Sumter Gambit. Then, we take a walk with Ed, who tells us just how wonderful it is to be back in the great outdoors after receiving exclusive procedures from the Bonati Spine Institute. Finally, pro-abortion legislators are urging the Biden regime to take executive action on the abortion issue, despite the Supreme Court already having ruled abortion is not protected by the Constitution. Rik Mehta joins us to discuss the legal ramifications of these actions. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So a new book is exposing the left's radical push of their extreme policies, from CRT in schools to extreme gun control to abortion laws, and has a dire warning that is this: it's only the beginning. Joining us to discuss is Robert Spencer, director of Jihad Watch and best-selling author of The Sumter Gambit, How the Left is Trying to Foment a Civil War. So thank you for joining us.
Happy to be here. Thank you.
Certainly. So let's start with the title. What is the Sumter Gambit?
The Sumter Gambit refers obviously to Fort Sumter, where the first Civil War started. And the first Civil War came about when the South was actually trying to force the North into starting the war and pushed the North into a dilemma where they either had to give up Fort Sumter, and that would be essentially acknowledging the independence of the Confederacy, or reinforce the federal troops that were there, and that would start a civil war. Today, the left is trying to push patriots into the same kind of dilemma, that we either go along with their radical agenda, with the drag queens in primary schools and all the rest of it, or else if we fight back, then they can say, you see, they really are the insurrectionists and traitors that we've been telling you they were, and they will use that as a pretext to crack down and implement more authoritarian measures, because ultimately these people are not respecters of the U.S. Constitution, and they don't care about our freedoms. They actually want to destroy them and create an internationalist authoritarian state. And the Civil War in America would be a step in that direction for them.
Now, you say that this Sumter Gambit is a strategy that's obviously been around for a long time, since prior to the only Civil War so far that we've had. But it really kind of exploded during the Trump years with the left bringing this tactic about. Can you elaborate on that a little bit?
Well, you know, the groundwork actually was laid in the Obama years. And then what happened with Trump was they were kind of wrong-footed. We're supposed to be right now comfortably in the middle of the second term of Hillary Clinton. And that was how the plan was supposed to go.
Yes.
But Trump derailed it in 2016 and forced them to take measures to try to destroy him, because he threatened to destroy their whole enterprise. And in their efforts to destroy Trump, they ended up outing themselves and telling many of the American people what they are really doing and who they really are, what they're really all about. But when you look back at the Obama years, you can see that the corruption and politicization of the military and of the federal bureaucracy in Washington and of so much more, he started it. And now we're reaping the bitter fruit of it.
Anybody who's a non-leftist, in other words, you don't swim along the current that they do, every non-leftist is getting pushed into what you call an impossible corner. Can you talk about that?
Take, for example, what I mentioned before, the drag queens in the primary schools. The parents went to school board meetings and started to protest. And what did the Biden administration, the Obama third term, what did the Biden administration do? They classified those protesting parents as domestic terrorists, and the FBI began investigations of them. And so, see, they think they're setting up a win-win situation. Either we just sit back and go along because we're too afraid of what they're going to do, or if we stand up, then they will classify us as violent extremists and so on and silence us accordingly. Right. Now, we have to not be intimidated by this. It is fundamentally an intimidation tactic. And the worst thing that the protesting parents could do in the face of that would be to stop protesting. Certainly. What we have to do is protest all the more.
So how do we protect ourselves from the Biden regime?
Well, for one thing, we all have to recognize that we all have to do it, that we have to become activists, that nobody's going to do this for us. Every person should be standing up and resisting wherever this agenda advances. And we don't see that. I have to say that because it's not happening. Even people that we look to as our leaders of the opposition, all too many of them have gone along with this aspect or that aspect of the left's agenda. Like even Ted Cruz, that many people on the right respect and admire, he went along with the insurrection fiction and made a statement about how terrible it was that these people tried to overthrow the government on January 6th. Well, that's a lie.
Right.
It is absolutely an insidious and dangerous lie, because what its goal is to ultimately criminalize and silence all opposition in the United States. And so Cruz had no business going along with it. And we have to be calling him and others like him out about that and resisting them vocally, peacefully, nonviolently, wherever and in every situation where they try to advance their program.
I wish they would release the footage, because you will actually see the Capitol Police remove the barriers and usher people in. It's so absurd. That narrative is insanity.
It is, but they're building on it. Now they just take for granted that there was an insurrection, an attempt to overthrow the government. They act as if that's been established. And then we had Joe Biden's speech last September where he says Donald Trump and the MAGA Republicans, because they're insurrectionists, they represent a threat to the very life of the republic. There's never been a president before who said that his principal opponent and half the electorate were outside the bounds of acceptable discourse. They're telling us what they're going to do. The next step is criminalization. We have to be aware and be resolute in resistance.
Obviously, we assume that Democrats in the party on the left are going to be like, even if they don't fully agree because they're closer to the middle than the radicals, are going to be like, well, at least it's our party that's doing it. But as Doc points out, even the Republicans, they don't like it, but they don't do anything about it except talk.
Yeah, well, a lot of them are controlled opposition. A lot of them are on the same payrolls. A lot of them are part of the same corruption. And so, of course, they're not going to speak out about it, or they're going to pay lip service to it and then not do anything about it. Even years ago, Congressman Tom Tancredo, the former congressman from Colorado, said he went to Washington to fight against illegal immigration, and he thought the Republicans would all be on board, and none of them would help. They all thought that illegal immigration was something that should continue. They didn't want to say it publicly. They would even say the opposite publicly. But when it came down to actually doing anything about it, they were nowhere.
What can we do to get back to, land of the free? How can we get back to our foundation?
Well, free people have to understand that now we have to take risks. We've been able to live very comfortably and peacefully in this country. And like I say, I'm not advocating anything remotely not peaceful and not anything illegal. But we have to stand up and take the risk that, yes, they are going to call us bigots and racists and hate mongers and all that. And that could harm us professionally, could harm us personally. But we have to stand now for freedom, or we will lose that freedom.
It's amazing. Online, the liberal loonies, as I like to call them, their first thing is playing, you're a racist, you're a bigot. I go, aren't you sick of playing that card?
That's
what else you got?
That's all they have. That's it.
Okay, whatever. On to the next one. What other insult are you going to sling at me now?
But you know what? It's all they have because it works. It keeps working because we let it work. And so that's actually one of the main points I'm making here today, that we have to stop playing the game.
Right.
And say exactly what you just said there, that, you're going to play that card again. This is a tired card. We're not falling for this anymore. And we're certainly not going to silence and deplatform the people that you demonize and stigmatize on your word. All that's over. It's just all important that we not accept their premises. All too often, we have been accepting their premises, letting them set the parameters of the debate. And that's what has to stop.
Well, it certainly does need to end. Thank you so much for being on the show with us, Robert Spencer, director of Jihad Watch and best-selling author of The Sumter Gambit, How the Left is Trying to Foment a Civil War. Thank you for being on the show.
Thank you.
Make sure you stay tuned. Coming up after the break, a story of recovery. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit askbonati.com. Hippocrates, the ancient Greek physician, said, "Walking is man's best medicine." And this is a belief Edward L. Green practices in his daily life.
I'm originally from the Bahamas, moved here in 1987, and been in the banking business 15 years in the Bahamas, then came over here and been in banking here 29 years. I live in Sebring, Florida, and about a year and a half ago we went full-time RV living, and I was able to retire my wife to do that. We love camping. I do some hunting, but I'm not really an avid hunter. We do a big family camp at Thanksgiving, and I usually hunt then, deer, hogs, things like that. And other than that, I just love to camp and do a little bit of hiking or some walking. And just love the outdoors.
But about 3 years ago, pain stopped him from walking.
It was fairly severe. It wasn't crippling, but it was fairly severe, more than I wanted to bear during the day. It started hindering me. I used to walk about 2.5 miles a day, and started hindering that to where I had no desire to continue walking because of the pain, and it would bother me at work as well, to where I would constantly be on pain pills. So had some degree of pain, probably in the area, sometimes 7 or 8, I would say, and it was affecting my lower back, coming down my leg on the right side at that point.
When other facilities failed to provide him with a solution to his pain, Ed discovered the Bonati Spine Institute and their targeted Bonati Spine procedures.
My family doctor referred me to a neurologist up in Winter Haven, and they basically told me, after a lot of tests and everything, that I should go on. If it gets worse, come back and see them, that there was nothing they can do for me. Well, after the pain continuing, I said, I'm not going to live the rest of my life like this. And a coworker of mine heard about a seminar that Bonati was putting on over in St. Pete. So I drove up there and sat in on that seminar, and very impressed with what I heard and the work that they do, and got to interview afterwards with one of the surgeons. I can't remember his name now. So then went up and made an appointment, and at that point, after taking some new MRIs, he walked in the room and was able to point out to me where my pain is based on what he saw on the MRI. Totally impressed me, said, yes, we can help you. That's the words I was waiting to hear, because I didn't want to continue with the pain.
In the summer of 2014, Ed began his lower back procedures. He recalls the experience with conscious IV sedation, a method utilized in the Bonati Spine procedures to ensure the main source of pain is eliminated by keeping the surgeon in communication with the patient.
I remember in some of the lower back surgeries, trying to recreate the area of pain to see whether I still had it or not. It was a neat experience because you knew that they were hitting the right spot by you being alert to what they were doing. It was a blessing, because that was the whole purpose of going there, and I felt content that they had gotten the issue taken care of and that I can go on with life.
Recovery time after the Bonati Spine procedures is significantly reduced compared to alternative surgeries.
I had a friend that had open back surgery, we call it, with a long cut, and he was out for 3 weeks. I had my surgery one day. Usually I was out of Bonati by about 12, 1 o'clock, something like that. Went straight out and had lunch with my wife, went to the hotel, rested that night, And that normally, it always worked out best for me if I did the surgery on Thursday, because then I got home Friday afternoon, and by Monday I was working from the house. Generally, once I got back to work, I took it easy for the first few days. Following that, then life just got back to normal more and more every day. Very quick recovery, and I could pretty quickly get on with life.
Because of the targeted tools and techniques employed by Bonati surgeons, pain is eliminated in a more efficient and permanent manner. So when Ed began noticing new pain in his upper back a couple years later, he did not hesitate to return to the Bonati Spine Institute in 2016 to resolve those issues quickly.
The pain has been resolved for each of the areas that I had the surgery on, and I have no more tingling or pain down my legs or my arms, because that was an interesting case with my upper back, because I was having issues with my hand and my finger freezing up and everything, and only to find out, no, it's not carpal tunnel. So I went back and saw Dr. Bonati, and he took the MRI and found out that yes, it was getting worse up in my upper back. And so we had the surgery, and that has now taken care of that situation as well. From the second time I walked in, Paul called me by my name. You know, that makes you feel at home. Then the ladies in the clinic, they knew me by then, and they were calling me by my name. So it was like going back home. They were able to take good care of me. And so of course I gained confidence then in the work that was being done, because I felt like I was in good hands, knowing that they had my best interest at heart. And it was an outstanding experience that I've shared with many people, especially those having back trouble, suggesting that they at least go and get a second opinion from there because of how well I was treated. And having done the treatment and now being able to return back to normal life without pain, I'm extremely happy about that, and would recommend it to anybody.
Since his final procedure, Ed is back to walking, enjoying the life outdoors, and sharing his experience with anyone who asks.
The question came up this week from one of my coworkers who's having surgery soon. And he said, well, the main thing I'm afraid of is paralysis and them hitting the spine. I said, well, for some reason I never felt that fear in the Bonati doctors, because it just seemed like they had the right equipment to do it the right way, and never had that fear of them. I never had that fear of walking out of there crippled or paralyzed in any way. So I share my confidence with them based on the experiences that I had. I would recommend the Bonati Spine Institute to anyone that is having issues with their back, or if they're not sure it's their back, if they're having pain in their legs or their arms. Based on the experience that I had there with them, I think I can recommend the Institute to anyone, knowing that they'll be taken care of by experts in the field, and that have their best interest at heart in taking care of the issue. I was totally impressed in the quality of care that I got, and just would recommend it to anyone.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know. So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome to American Medicine Today. So, pro-abortion advocates and Democratic legislators have both been urging the Biden White House to take extreme executive action on the abortion issue to protect people's rights. Well, that's their words. But is that constitutional? Joining us to discuss is Rik Mehta, former FDA official and current Georgetown University healthcare professor. Welcome to the show.
That's great to be on. Thanks so much for having me.
So can you tell us about this suggestion by Health and Human Services Secretary that Biden declared a public health emergency over abortion?
Yeah, that's right. So just to unpack this, there's actually a lot going on in this space. Since the Dobbs decision, we saw that the Biden administration has been furious at the fact that the federal government can no longer commandeer and tell states what to do. In the Dobbs decision, we saw a very interesting read to say that there is no right to federal privacy, basically suggesting and kicking it back to the states to say that if we want to legalize abortion, you have to leave it to your elected representatives.
Yes.
And so what we've seen through COVID with the declaration of public health emergency and this very loose interpretation of what constitutes an emergency. The Biden administration has taken a lot of liberal approaches to declaring many things as a quote unquote federal emergency in order to continue to aggrandize the federal government and usurp states' rights and bring it back into a federal public fold. And so it's no surprise right now that the Biden administration is contemplating, declaring a public health emergency for abortion on the premise of allowing for an expansion of abortion rights into states that have started to restrict abortions based after the Dobbs decision.
But how can they do that once the Supreme Court decided to remove Roe versus Wade? How are they able to force this on us?
There's a couple things going on here. Now, the other thing to consider also in the backdrop is a federal case right now in the state of Texas that is a lawsuit brought by the Alliance of Hippocratic Oath against the FDA, suing the FDA for approving and asking for a temporary injunction to stop the distribution and the approval of mifepristone, which is the main drug used in medication abortions. And so as that's unfolding and, likely to rule soon, if the judge does, in fact, declare that the FDA illegally or invalidly approved a drug for abortion, then it could potentially stop the distribution of medication abortions. As such, the FDA the Biden administration could declare another public health emergency in order to surpass this, overcome this lawsuit to allow for the distribution, possibly under an emergency use authorization again. What is the constitutionality of it? I think it's going to be challenged. There's a high likelihood that it's not going to be held valid. But again, this has all been a political play to use public health emergencies in order to push a political agenda and not necessarily based on merit or science.
What I don't understand as a female, is it really a health emergency? I mean, there's just women everywhere in the world lining up because they got to have their emergency abortions. I mean, are they that reckless with themselves that they're having sex with anyone and everyone all day, all night, getting pregnant left and right? And the only way to solve it is to murder these babies?
The Dobbs decision didn't say that abortions are illegal. They said it's up to the states on the legality. For example, my home state of New Jersey, if anything, we've expanded access to abortions, right? So again, it's not chilling the ability to receive an abortion. So really, you have to question what is the scientific basis of wanting to declare an emergency around this. And again, this is to cater to a base that's extremely progressive and radical. And heading into an election season, we know that this base has been pushing the Biden administration to do more, despite the fact that you have a constitutional ruling, a Supreme Court ruling on the constitutionality of this to say that this is within the state's mandate. They're continuing to push the Biden administration and President Biden himself in order to go beyond the Constitution. They may do it, but they know they're going to be challenged. They know they're going to lose in court.
It's amazing to me because you see what the left does. They say it's feminist to fight for your right to go murder children. What it comes down to is they don't want men to have responsibility. So men can impregnate the women, and how wonderful it is for these men to cheer on the feminists. Yes, go get your abortion. We're okay with it because it lets them off the hook. They don't have to pay for child support and they take no responsibility.
So I think it's disgusting what's perpetuated in the name of feminism and by this Biden regime.
Yeah. Well, and if you look at what happened in 2021, even the alphabet soup agencies have been involved to start to increase access to abortion and go beyond what the state's wishes are, right? So the FDA, for example, lifted the REMS restriction, the risk evaluation and mitigation, basically saying that, if you want to pick up a medicine that induces abortion, you have to do it in a healthcare facility. They lifted that regulation. They lifted that rule. So now it opened the door for mail order medication abortions, right? So now you see an increase in telemedicine visits. You see the medicine being shipped through the mail at home and people doing abortions at home. In fact, medication abortions outpaced surgical abortions over the last couple of years. So this is the crux of the lawsuit, to say, is this really safe? Now, the FDA first put these rules in place because they knew the drug wasn't safe. They knew that there was a lot of adverse events happening with it, and that you can have bleeding out. If you take it at the wrong time, there's high risk of mortality if taken wrong, or if something happens, you need emergency medical treatment. The reason why the FDA said it had to be done in a healthcare facility, and somehow they just lifted that rule without any safety basis.
As a former FDA official, though, Rick, why do you think that is? Why would the FDA just do a quick about face on their previous ruling and just be like, yeah, it's okay now?
Well, this is the $1 million question, right? I think they were pushed politically. Remember, the FDA is an executive branch agency. They report up to the HHS secretary. I think there was a big push to continue to expand. They knew that the Dobbs decision was coming down the pike. And so that time in 21, they decided to lift this rule in order to increase access to mail order medication abortions.
I can't wrap my head around why the left are so upset about the Dobbs ruling. And because, if you live in a state, why not leave it up to the states? I don't understand why the federal government should be in charge of your body and your body's rights.
As a former U.S. Senate candidate, putting on my political hat, I think a lot of this is just like red meat for their political base. They're going into a supercharged 24 election year. The Biden administration wants to win their second term, and they know that they're out for blood on this one, and they know that this is what charges their base. They used it in 22 to draw out more voters to the polls. And I think that this is going to be a major push for their political talking points.
Well, they're out for blood, and boy, they have it on their hands with the murder of countless babies. Thank you so much for being on the program, Rik Mehta. Thank you for joining us and shedding light on just the absurdity of the Biden regime trying to promote an abortion health scare.
Thank you. It's my pleasure.
Thank you so much for watching American Medicine Today. Make sure you check us out anytime on the YouTube channel. Search American Medicine Today, and we'll see you next week, 4 p.m. Eastern. Thanks for watching.
If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.